for helping out. Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheim, and April is Animal Cruelty Prevention Month. So today we'll be discussing why humans hurt animals, intentionally, unintentionally, and how to prevent it with special guests. Kenn Altine, Chief Executive Officer of the Sacramento Society for the Prevention of Cruelty to Animals. Alexis Pagoulatos, Chief Executive Officer of the Animal Rescue League of Berks County in Pennsylvania, and Bill Ganley, Vice President and Chief of Humane Law Enforcement of the San Diego Humane Society. So thank you all for being here, Kenn, Alexis, Bill. It's wonderful to be talking about this topic, and let's sort of go around the room here and just talk a little bit about what you do. We live close to animals. We love them. We sometimes work with them, and sometimes we also neglect them. It's a really big issue, and it also affects people of different levels of wealth differently because means connect to treatment, particularly medical treatment. So let's go around the room. Let's start with you, Kenn. Give us the 30,000-foot view of the state of our situation now, where we are in COVID, where everybody's gotten pets, right? You've had this huge influx. How do you see the situation in your region?
Well, I think that we're fighting two things. One, a lot of people acquired pets. Many of them came from shelters. Many of them didn't come from shelters because so many shelters were closed. And many of the pets that were acquired were unaltered because they didn't come out of shelters where they get altered. So we are seeing sort of explosion of puppies in a way we hadn't seen in a while. But what we're really seeing is this mass increase of pet ownership, first-time pet owners who added 2 or 3 animals, intersecting with the sort of veterinary crisis, which is a lack of veterinarians and a predicted shortage of veterinarians that will only get worse in the next 8 years.
How did this happen, Kenn, that we have such a shortage of veterinarians? Right? I mean, it's a long pipeline, and all of a sudden we have a supply that does not meet demand. How did this happen? Was that because of the acquisition of so many puppies and the increase in demand for veterinary services?
No, so we were sort of signaling warnings back in 2018, 2019, based on some surveys done by the California Veterinary Medical Association that predicted a shortage. It is a combination of vets coming out in exceedingly high debt, a really high sort of dropout rate, if you will. People get into veterinary medicine 5-6 years into it, they're completely burned out and they get out of veterinary medicine, coupled with a large movement to sort of corporate veterinary medicine. We have corporations that built up Mars M&M. People don't realize it makes way more money from the pet industry than they do from the candy industry.
It's so fascinating. You're drawing connections across all of society. Alexis, when we were talking before the show started, you were talking about the connection between how a pet's condition is reflective of how the owner is living, and you're drawing all these different connections in your work over in Berks County. Talk about how you see it from a 30,000-foot view, and then Bill, it would be great to have you weigh in.
Yeah, I echo a lot of what Kenn was talking about, and here at the Animal Rescue League in Pennsylvania, we have seen we've got a very diverse population here, and one of the things that is really became crystallized during COVID was as people kind of entered stages of their lives where they were more vulnerable pets are not far behind. And so we talk about a great deal, as an industry now, about human animal support services. We don't just help pets anymore. We help animals. I mean, we don't just help animals anymore. We help people too, just as much frequently. One of the things we kind of encounter often is not that people don't necessarily want to do the right thing, but they may not have access to resources or even education on what exactly the right thing is or how to go about gaining access to resources. And we see a very concerning divide between, there's a lot of disparity out there. And when we make resources accessible, when we can find grants and funding to do that, to make that accessible to people, they want to do the right thing by their pets, and they come forward in droves to try and, get vaccinated and spayed and neutered and, get vet care. I think it's just an enormous challenge for shelters because we have very limited funds. Our funding sources are lean. They typically are not tax funded unless they're a municipal shelter. And even then, the sector is chronically underfunded. And it shows, but we do the best we can with what we got.
It's really part of a family need, isn't it, Bill? I mean, when you look at what happens on the street, right, and either from the social work side or from the law enforcement side, those are two sides of one coin, right? How do you see where you are? San Diego is way different than Sacramento and real different than Berks County. How do you see the situation in the San Diego region?
Well, I echo both of my colleagues' comments as well, but I definitely see in like what Alexis is talking about, that human animal support services network approach, where people are struggling, their pets are going to struggle as well. And so we have, one of the issues we have is that while San Diego is a large city, the public transportation for someone to get into the shelter with their animal, if they're going to seek services, whether it's a vaccination clinic or licensing or anything, it's very difficult for them to get here. So one of the things we've tried to come up with is partnering or using rideshare services and providing vouchers. So we're exploring it now on the humane law enforcement end, where I'm sure you've all faced it too. We have a higher amount of surrenders, people trying to come in. And our goal is to keep that animal with the person if we can help them. We want to do those things before they get to the point that they're bringing them into the shelter. But it ties in hand with cruelty and abuse and neglect. And what people don't realize is some of the things they're doing aren't good things for their companion animals. And so we hope to help educate people and bring them into the fold, I guess.
The thing that really strikes me about all of this is that this isn't a political philosophy. This is just observed situations on the street, right? I mean, when you, Alexis, are talking about the connection between human health and animal health, and Bill, when you're talking about people just, being in such despair that they surrender, they want to surrender their pets because they don't have the money. Right. And Kenn, you talk about the fact that we don't have veterinarians. And what we're actually talking about is this sort of connection. And it's not a political thing, is it? I mean, none of you care about, who donates a puppy or takes a puppy in terms of, you don't ask for their party registration, right?
We don't even ask for their geographic location. We're just like, I think one of the common themes we're really seeing here is that our communities need to better understand that we are community organizations, not animal organizations. Animal is in our name, and it's an historic thing, but actually without people, we're sanctuaries, right? So if we can better communicate.
You're human services.
We are human services, right? Because I consider, our responsibility to pets and our need for pets in our lives is quintessential to the human experience, right? So we are human organizations, we are community organizations, but far too many people see us as the sort of punishment organization or the organization you only use if you want to get rid of an animal or get an animal. And all of us have worked for years to really broaden the scope of what we do to help animals and the people who love them. But I don't think everyone understands that. It's a messaging, it's always messaging, right?
So let's talk about some of those programs. Let's talk first about the whole idea of trying to reduce the number of people who have pets giving birth to pets, giving birth to pets, giving birth to pets. And let's just go around the room. We'll go around and each person can talk about one program. Alexis, you want to talk about those programs, or do you want to choose another one?
Sure. Generally speaking, spay and neuter is very central to a lot of our operations and animal sheltering, because we know we've made so much progress with that over the last several decades. And it's incredibly important, not only for the health of the animal, but for health of the overall animal population and the societal systems that support these animals. We know back in the 60s and the 70s, we had exponentially more overpopulation challenges than we do now in certain parts of the country, but other parts of the country are still really struggling. And so that's where you also see, transporting happen around our country to try and help distribute animals better. But so generally speaking,
spay and neuter programs. Bill, do you want to take Alexis's prompt on the distribution of animals and adoption and so on and so forth, and talk about those programs?
Well, sure. I'm from originally from the Northeast, and I can tell you in Massachusetts and New Hampshire, they're starving for animals, for dogs. If they could get a shipment in from an area that's inundated, they're gone so quickly. And I look at it and say, oh, I wish we could send dogs all the way across the country and help them. We do our best. We kind of work with our partners in this area, where I know we're taking an intake today from one of the areas further into the western part of the county. But I just want to mention on those spay and neuter, our goal when we go in, we just did it yesterday. We took 11 animals into care from a one-bedroom apartment. An officer's been working with that person, and 5 of those he surrendered, and we'll work with a rescue and try to exit those dogs out through a rescue. And 6 we're going to neuter or return to the owner after being spayed or neutered, and work with that person about the sanitation and everything else. So I mean, our goal, and not to pivot on you, but our goal is to try to keep animals from coming into the shelter. We want to put ourselves out of business, right? When people want to rehome their animal or surrender, we're talking about giving them alternatives. There are great websites that they can do it, and tap into the power of social media, where people will help each other, neighbors helping each other. But there's still that mindset. People say, oh no, bring it to the shelter. And we're like, no, wait, there's another way to do it. So,
when I've worked with law enforcement, the best experiences that I've had have been people who take a very integrative approach, and they're looking at solving problems. Sometimes they're enforcement problems. Sometimes there are other ways to solve things that combine this, and that's what you're describing. You're talking about enforcement issues, right? But then you segue, right? And your folks are basically problem solving. It's exactly the way our first responders need to work in order to really help us all have a better civil society. Bill, thank you for describing that.
Thank you.
Kenn, you want to take a particular program? You already talked about the veterinary training,
right?
But we've got so much, right?
We do.
Of human beings and
and to build off what Bill was saying earlier, my organization does 20,000 spay-neuter surgeries a year. 20,000. I mean, we're one of the largest spay-neuter providers in the United States, and we're still booked out 3 to 4 months in advance. And so it's not that people don't want to get their animals spay and neutered. We proved this. We expanded our capacity. We hired more vets. We built out more to try to get that wait time down. Because if you say, yes, I'm ready to get my animal spayed neutered, I've got the money, I've got the car to get there, and now you're telling me it's going to be in, for us, now you're looking at July. In July, I might not have the money. I might not have the car. I might have changed jobs, or my job hours have changed, and I can no longer keep that appointment. So we absolutely see in every community in Sacramento, there is a huge desire to do it. They simply cannot access it.
Well, according to those numbers, though, if you do 20,000 spay and neuters, you're backed up by about 5,000 to 6,000.
Yes.
Right. And that's a 5,000 to 6,000. That's a huge backup, particularly when you think that in back of those are another, X number of thousands of needs. You might have a need out there that is that never comes to the fore. Nobody ever makes an appointment, so you don't register the fact that you're that backed up. You could be backed up by 50%.
And in that 3 to 4 month period, you had one dog that needed help. Now you might have a dog and 7 puppies that need your help. So your need
you all
has
finding
grown.
the same thing as Kenn?
Yes.
I think one of the clearest things that has evolved, particularly out of COVID, because there became access challenges for private veterinary practices.
Mm-hmm.
I think what we are starting to see is a shift where animal shelters are now starting to feel the need, the requirement. We feel very pressured to respond to this community need that we see by building out these spay neuter programs that we, not necessarily all of us felt we had the ability to do. And now we feel like we can't not fill that need. And I think it's kind of leading toward a future where animal shelters are really going to become animal welfare community resource centers, where people can come, and we will likely in the future be where the masses kind of come for vet care.
Basic
and so
veterinary care. Exactly.
The basic
That's really
care. So
interesting.
we're struggling to meet, I think we're all struggling to grow to meet the community need. And we see it, and it feels pretty dire from our side. So we're all trying to grow.
5 years ago, we did not set out to be the largest healthcare provider for animals in Northern California, but now we are. We provide healthcare, whether it's spay neuter, whether it's low or no cost vaccines. We do wellness exams. We service 40,000 animals a year now at our.
You're an animal care co-op, basically.
We are an animal care organization,
right?
And not. It's what we do. I mean, we have 12 vets and 6 RVTs and full service clinics, and we cannot meet the demand. And it used to, the old thought 10 years ago was be careful about opening up a spay neuter clinic or doing any type of services for veterinary care because you're going to anger the veterinary community, right? That was the old thought. And now the vets are saying, can you take this case? We have vets sending us cases because they cannot meet the demand.
Amazing. Bill, we just did 2 polls. One was how many people have witnessed the animal abuse, and interesting, 80% of the people said that they had witnessed. Reporting is more 50-50. People are reluctant sometimes to report. Could you just talk a little bit about the workflow that you encounter, how what your intake is, what your intake process is, and then how you prioritize cases and get to resolution, and then also in the aftermath of resolution, because it's a workflow that extends beyond.
Sure. Yeah, I don't, those statistics, I figured there would be just about that. People see a lot of, there are a lot of things that happen in the community. You see, oftentimes you'll see people being rough with their dog or as they're out walking, sometimes, striking them. And so we'll get those calls. We have to prioritize our responses. We 1 through 5, anything that's a emergent, issue, active animal cruelty, or dog that's, say, attacking, or animal that's hit by car, that's where our officers are going immediately. So one of the things I think one issue is people don't want people to know that they called, right? And so what we tell people is we don't disclose that information, but if we're prompted to by the court, or if it goes to something, we do our best to keep those the names out of it, and we do a pretty good job. But a lot of the things I think are people who don't actually, they think they're seeing cruelty, but it doesn't quite meet the definition of the law. But they're concerned, and we want them to call us, so we encourage that. But our dispatch center is now 24 hours. We handle probably 100 calls per day during the daytime. Our officers have responded, I think last year, over 20,000 calls for service. We cover a pretty large area here down in the greater San Diego area. But when someone makes if there's a case that an officer is investigating, and there is they develop information that results in that, a felony or a misdemeanor has been committed, they'll put the case together and they'll submit it to either the city attorney's office if it's a misdemeanor, or we have partnerships with the district attorney's office in felony cases. But we work so closely with them, and we're aligned. We have a task force, an animal cruelty task force. We're not looking to hit with a big stick. Like if we can educate, we talked about that, diversion. Our goal is to return animals to owners if they're capable of handling, caring for them properly. California law states that very clearly. We can return animals to people if we feel they can properly care for them. If we feel they can't, then we don't. But more often we do. So
the integration of an enforcement, sort of an investigation and enforcement side, and then it sort of turns into an education piece, because you're educating from the first contact, right? I mean, if you got a report on me, right, and your officers came, from the first contact, you're educating me in terms of you're trying to do an investigation, but you're not trying to take my dogs away. You're trying to ensure that my dogs stay healthy and happy and with me, right?
Can we turn that not great home into an okay home? Can we turn that okay home into a good home, right? How do we improve the situation where the animal is? Because if you assume good intent, these animals aren't hated in their home. They may not be as loved as my dogs are, or your cat is, but they're part of a family. And if we can really help that family improve, if we can give them watering bowls, if we can give them leashes and collars. One of the things we try to do is when we see someone with one of those prong pinch collars is, can we give you a Cincy harness? Can we give you a better way to solve the problem? We understand the problem. It's a strong dog and it pulls, but that's a cruel way to, can we, instead of just shaking our fingers, can we get you this free harness and trade you that? Can we just trade you that? And now you're controlling that behavior of the dog in the way that's better for you and better for the dog.
Are you basically saying, Kenn and Alexis, it would be great for you to have you jump in, is that what we really need to do as like people, like Americans, sort of figure out the perspective of the other person, right? And if they're having a problem and it goes to Bill or whatever, they're just having a problem, right? It doesn't mean that they're instantly evil or need to be treated with disrespect or any of that. Now, it doesn't mean that that's not a bleeding heart thing. It's like, just treat me the way I'd like to be treated, and I'll treat you the way you'd like to be treated. Isn't that what you're talking about, Kenn?
Yeah, I mean, the police learned a long time ago, if you're pulling over somebody for any violation, and there's an infant in somebody's lap, the best solution is to find them a car seat, right? Not fine them, not punish them, not say, don't do this. You're going to have to walk home with this child now because we can't. Find them a car seat. Solve the obstacle.
Of the problem.
Identify the obstacle that's preventing them from doing what you want them to do.
We just asked a question, Alexis. We said, what are the biggest reasons people sometimes fail to properly care for their pets? So we have a number of answers. What's your answer? What is the
kind of along those same lines? A lot of times we've got cultural differences and norms that of how family animals live compared to other folks. A lot of times it's kind of we try and educate and provide resources, and then sometimes when that fails, that's where enforcement begins. And so I think there's a big challenge there sometimes of trying to help neighbors, especially, understand that they can catch more flies with honey. So if they see, for example, inappropriate shelter outside for their next door neighbor's pet, maybe make some friends and maybe offer to buy a new shelter, or hey, I'm going to take my dog for a walk. You want me to take your dog for a walk with mine? Just trying to be neighborly instead of kind of assuming the worst of your neighbor, kind of, try and embrace kind of that neighborly kind of spirit to try and deal with this, as sometimes it kind of takes a village. And then, we do supply some resources like Kenn was talking about. sometimes if people are really struggling and they're at their wits' end with how their dog's behaving, we can provide dog training scholarships. That's a program we have here to try and help people get the tools that they need to get to a better place with their
Leashes,
dog.
collars, food,
Yep.
training,
100%.
water bowls, what is it they need? Sometimes I think when it comes to the reporting issue is our view of what is awful differs from other people. And Bill, you said something earlier that really resonated with me. You want to talk about that?
Yeah, it was a term that another animal control officer had mentioned to me in a chat on Nextdoor, the social media site. And she said, awful, but lawful. We may not like what we see. It may not be what we as people who love animals and our way of knowing that would treat animals a certain way, but it's not illegal. And food, water, shelter is the mantra in California. And but again, I think you said it, Mark, too, at the beginning. We were talking about COVID and the effect of COVID on everything. People pulled back, people sheltered in place, closed the doors, and we can't go out. We got to stay 6 feet away, and now we're coming back out. And I think it's a challenge. And Alexis said it, being neighborly, understanding who your neighbors are and what is important to them, and just opening lines of communication. And I think that barking dog complaints, I'm telling you, I don't know if either of you have an investigation of those. Thankfully, in the city of San Diego, we don't have to cover that, but we do cover it for the 13 other cities that we handle. And I go back to, is that a real big deal, a barking dog? Well, if you're trying to work at home or you have a baby who's trying to sleep and someone's not addressing that, it's miserable, So what we do is we send a letter out and with ideas of trying to make, corrections and things. So we're trying to give them an opportunity. And eventually, if it continues, we might go out and do a welfare check to make sure the animals aren't being treated improperly. But it's all about just trying to be good neighbors. And I went to a dinner last night. It was the 7th annual iftar dinner, law enforcement iftar dinner in San Diego, and it was the for Ramadan. And the message from everyone at that dinner was just that we're all the same, really, and so if we can all just talk, we can be a better society. So the same thing with our animals. So
really, really inspiring, Bill. One of the things that I'd love for you all to comment about is that I've been doing human services for much of my career in and out. And it's been in children and family services. And of course, now we do a lot of work with all sorts of different organizations. My daughter lives in Oakland, in downtown Oakland, near a homeless encampment. There are animals in the encampment. One of the things that I noticed is that it's incredibly disciplined. The setting is not a setting that I'm living in, but if you take the setting away, and you look at the caring that goes on, you sort of see the whole range of different behaviors, right? And then down the street, there are a number of fenced-in small homes with dogs that are obviously guard dogs, and they function as dogs, they behave as guard dogs. But one of the things that I've noticed is that there are about 4 or 5 different homes like that. The entire neighborhood is looking out after the dogs. Right, and the dogs are part of the neighborhood, right? And they recognize people. How do you see it in terms of what you see on the street in terms of people in different circumstances? And is there a problem that has to do with homelessness, or is it a problem that really is that those people can't necessarily care for the dogs in terms of veterinary care? And what's the issue? Is it attitudinal or is it means?
Yes to all of the above, right? And we have a question from Carol Walton saying, what about when you see a homeless person on the street with a pet, and what's the best way to help this pet? So the challenges in the homeless or the unhoused community, one is there's no access, but often those animals are adequately fed and watered. They're a companion, and they're highly socialized if they're in the camp. If you got an out of control dog, the rest of the people in that camp will not
That's awesome.
tolerate it. They will sort of self-regulate it, if you will. The challenge becomes as we work with the providers of services to transition people into some type of housing, is the animal is the first barrier. The first we see it in California, we see it in fire, disaster, right? People are fleeing their home of every economic, social background, and they can't enter any type of emergency housing because they have pets. So it's the same challenge, regardless of whether you have money or not. But when you're in unhoused, those agencies that say, yes, we allow your pet, but it's got to be vaccinated, it's got to be have rabies certificate, it's got to be all these things that you don't have access to. So they immediately throw up that barrier. So I'm not going to leave my pet, and my options are very limited because I have this animal companion, because I'm a human being.
Alexis, we're going to give you a word, and then Bill, you're going to have the last word. If you were to think of one thing that we could all do, either on a governmental, regional level, or that you could do, what would that be to make the situation better?
Well, when I look at systemic challenges that we face as a society as it relates to animal welfare, one of the things that I think people misunderstand, and we're trying to shift our model. Animal shelters were historically reactive, and now we're trying to be very proactive. Mm-hmm. And one of the biggest challenges that I think we see across this country is the challenge of housing insecurity. Pet-friendly, affordable housing is actually would if we could fix that problem where our communities have access to affordable pet-friendly housing without barriers, that would open about 10.5 million slots for pets to move in with their owners into affordable pet-friendly housing. And currently we within, if you just look at euthanasia numbers alone in animal shelters in the United States, we're about 1.5 million animals get euthanized each year in animal shelters. And a large portion of those are, in areas where they're euthanized because of space challenges at shelters. Mm-hmm. So if we could address some housing insecurity challenges, it's not that necessarily we have pet overpopulation. We have distribution challenges of where pets are in our country, and housing insecurity challenges that make it very challenging for people to move and live with their pets. And if we could move a needle, it would transform our shelter situation across this nation.
It's such a great point, Alexis. Bill, take us out. What is the thing that we should all do tomorrow?
Oh, well, I will say this. Our community engagement team goes out and works in the schools. And that's what we need to get to the kids and talk to them about, what is a proper way to handle an animal, and how to approach and what we should be doing. But I agree with Alexis, the housing issue is number one. But if we can help teach our children about animals, they in a lot of the communities that we serve, they can help teach their parents. I learn from my kids all the time. They're giving me all the lessons about what's happening in the world right now. So it's a two-way street, but let's get to the kids and talk with them.
And my solution is free spay and neuter clinics in every major metro in the United States. The reason is because the net is financially beneficial, right? There you go. We've just saved a boatload of money. All we have to do is help figure that out. Kenn Altine, Chief Executive Officer of the Sacramento Society for the Prevention of Cruelty to Animals. Alexis Pagoulatos, Chief Executive Officer of the Animal Rescue League of Berks County in Pennsylvania, and Bill Ganley, Vice President and Chief of Humane Law Enforcement of the San Diego Humane Society. Thank you so much. This has been just a fantastic conversation, and I really love the fact that you are presenting the truth about these organizations, that they're integrated into our society, into the quality of our lives and our communities, into human services. It's about animals, but it's also about humans. Thank you so much. Thank your staffs, boards, donors. Really appreciate it.